And welcome back. Very interesting topic we're going to talk about today, stem cell therapy. And we have as our guest Dr. Gaurav Goswami. Did I pronounce that right?
Yes.
Nice to have you here. Of Precise
Thank you.
Care. And you folks sent over some stuff that I read. Let's talk about first, people hear about stem cells in the news all the time,
Right.
especially over the last probably 10 years. And usually what you hear, it's a very precise technology. Often the stem cell, in some cases, a little bit of controversy in that how they are harvested.
Yes.
Years ago, we heard that the only way, I think, were from fetuses. I'm not quite sure. And then later on, as technology has changed, they found other ways to do this. So first, let's talk about you. What is your background and how did you get into this field?
Okay, so my background is, my training is in surgery as well as interventional radiology, which
Okay.
is a specialized field of medicine where we use imaging guidance to do procedures. So for years I've been doing injections into the joints for arthritis and
Okay.
various conditions. And most of those injections, as you know, have been using steroids to cause
Sure.
some partial relief or temporary
Right.
relief of the pain, which we all know is not good for our body in the long run. And it's not effective in a lot of situations, and eventually these patients end up undergoing surgery or joint replacement surgery or some other kind of surgery. What research, especially about stem cells, that has happened over the last decade has been that the emphasis has shifted from embryonic to adult stem cells. We as adults actually have these stem cells in our body because, as you know, our body is constantly renewing itself. You know, we are in fact changing. You know, there's not a particular time, but there are some organs which change every 3 months, some organs which are changing every month. So each organ has the seed to regenerate itself. With research, we've also found that some of these stem cells are like the basic raw seeds, can differentiate into some other cells too. And using that as a basis, what we are now able to do is use stem cells to regenerate or repair tissues that might be damaged.
Okay. Because, you know, again, there's a lot of misconceptions about stem cells.
Right.
And I'm sure, depending on their uses, eventual uses, the embryonic stem cells are different than this and that, especially when people are talking about research and Alzheimer's and all that kind. But I certainly have heard that your own stem cells can regenerate tissue. In some cases, there's even research of how to regenerate limbs or something eventually. One day we may get there. What exactly does the therapy do, and are there very specific areas where you can get these stem cells?
Okay. So since the emphasis, and I want to make it clear that we do not use any embryonic stem cells, we do not use even the umbilical cord stem cells. What we are really focused on is tapping our body's own natural ability to heal itself. You know, just like we are moving towards less and less invasive procedures, we're moving towards a shift away from using too many drugs or medications, which ultimately harm us.
Right.
The current research is focused on using adult stem cells, and one of the exciting areas that I really feel excited about is arthritis and joint and injuries, bone and joint injuries, because for years we've not had really a good solution for those problems. However, if you know, there are a lot of athletes who have traveled abroad, you know, Kobe Bryant being one of them, who recently traveled to get PRP and stem cell therapy done abroad, because these cells have the ability to duplicate themselves into cartilage, bone, ligament, and other soft tissues that support the bones and joints. So that's what we are really focused on. And there are two sources of adult stem cells that are really important and very easily accessible. one is bone marrow.
Mm-hmm.
And in fact, bone marrow transplantation is a form of stem cell therapy, which has been used for blood cancer now for many years. The other is fat. Our own fat has stem cells that can duplicate into cartilage, ligament, and other joint structures. So what we're really doing is that we have relatively easy sources to draw. This is actually, in fact, a completely outpatient office-based procedure where either the fat is drawn with a little liposuction or the bone marrow is aspirated. And then obviously the sample goes through a series of steps where we spin it, we isolate the stem cells, we document that those stem cells are viable, we make sure that we count how many stem cells, and then under X-ray and imaging guidance, which is very, very important, these are then injected into the joint just like you would be getting any other shot. So
you want to make sure, obviously, the stem cells that you're getting are not potentially infected with some other disease, cancer, or whatever it may be. How often are these therapies needed? Does it depend on the person? Is it one time? Is it every month? Because we know with standard joint therapy injections, it can be once every 3 months or something with the steroids and things like that.
It's definitely not that frequent, although the science is still evolving. And there are some variable factors. You know, the quality of the stem cells can vary in each and every person depending upon their body and also depending upon some other medical conditions that they may or may not have. So that is why the documentation of how good the stem cells are, how viable they are, what their numbers are is very, very important. The good news is because they're your own stem cells, there's no downside, there's no risk of rejection.
Right. If it doesn't work, it's just
There's always a small risk of infection, just like any other procedure, but patients are usually on antibiotics. And the third thing is it can be repeated. You know, we always can find enough fat in all of us.
I would say probably too much, right?
So from which we can isolate stem cells. But it's hard to say right from the beginning how many treatments a person would need. But I've seen good results with 1 to 2 treatments. You know,
really?
And usually we separate them about 6 months apart. I mean, the thing
that really, a lot less than
the thing that really got me excited was that I had a patient on which we did the treatment. He had an MRI done 6 months ago, and then we got an MRI 6 months after stem cells. And I took it to my radiologist friend to compare the MRIs. And the first thing he said was that the second MRI is actually mislabeled. It doesn't belong to the first patient. And I said, what if I was to tell you it is? And he was shocked because he's always seen worsening and deterioration. He said, how did the cartilage come back? Because I've never seen cartilage regrowth. So it was very, very gratifying.
Interesting.
Pain relief is almost instantaneously within a week of having the treatment. And then we assess at 6 months with an MRI to make sure that there is cartilage regrowth. And you know,
very good. What is a platelet-rich plasma? I think most people might know the plasma comes from the blood. When you go now and donate blood, at times they will just be using the plasma part. And so how does this fit into what you do?
So platelet-rich plasma, actually the common lingo is PRP, which stands for platelet-rich plasma. Again, you know, the Yankees pitcher recently got his elbow injected with PRP. Platelets in our body have long been known to have such strong factors that can control inflammation, that can promote healing. So PRP is basically, again, drawing the blood, just like an IV. We draw the blood is spun, and then the platelet-rich plasma portion of it is gleaned out and then injected into the joint. In fact, this is now proving to help stem cell therapy even more because platelets have such healing capacity and they have so many good properties. So I actually call PRP like a fertilizer, which I inject into the joint right before injecting the stem cells. So now you got the combination of a good fertilizer, your own platelets, and the seeds, the stem cells.
Right.
So it's really panning out well.
Yeah, how long have you been doing the actual stem cell therapy?
We've been doing it for the last year.
And I know it's been done in Europe for many years. It's
Right.
relatively new here.
FDA has approved the treatment. You know, there's no reason for a lot of people who go abroad, they actually end up spending a lot more money. FDA has approved, and in fact, there is a strong push because so far the debate had gotten very political and ethical because of embryonic stem cells. And now that the focus has shifted on adult stem cells, I mean, the government is putting in a lot of money into the research. So every day we are finding out new indications, new hope for conditions that we had otherwise given up on. And that's what the most exciting part is.
When you first see a patient and you evaluate them, is the time when you decide, okay, we feel this will work for you, as opposed to the other treatments, the more traditional ones, at least the ones you've been doing over the past years?
Absolutely. I mean, for any procedure, a thorough evaluation is extremely important. So we obviously assess the patients, their medical conditions, their needs, their goals, and also imaging. Imaging is very important to make sure where they are. Majority of the patients that I see are either young athletes with injuries, and you know, they obviously want to heal and not be on painkillers and other drugs, as we've heard recently.
Yeah.
You know how damaging those painkillers can be in the long run. Or adults who are now being recommended either arthroscopic or joint replacement surgery, and it's been very gratifying. Majority of the patients, you'd be surprised, are candidates for this procedure because there's no real contraindication. It's your own stem cells.
Right.
That what we still are obviously working on is consistency of results and studying other factors that might influence the outcome.
Do you literally inject the stem cells into the affected cartilage area or the joint area, whatever it may be?
Yes.
And can it, you talked about arthritis. There's all kinds of different arthritis, whether it's a joint, there can be you know, rheumatoid arthritis and osteoarthritis. Can it help all those or just certain ones?
A majority of those, you know, a majority of those. Obviously, we do look at the location, you know, where it is.
For some people, it travels around the body. I know that my wife and mother-in-law have arthritis, and it's not always in the same place when you have RA.
Right.
Yeah.
Majority of our focus right now is on the large joints, the knees, the hip, and the shoulder. And we are being very cautious with this. We don't want to sell it as a silver bullet.
Right.
You know, we're not, but I think it's a major step, a huge step in the advancement of medicine, you know, especially when it comes to joint injuries and arthritis. And majority of the conditions, like I said, you know, can benefit from this therapy.
Yeah, I can see that. And I can really see how, you know, this is something that's ongoing, and that more and more information is probably gotten every month. You're located down in Newport Beach. And by the way, their website is precisecare.com. Do people, if they want to come and see you, do they have to go, you know, a lot of people here on Medicare and things like that, do they have to go their primary first? Are you on Medicare, do they, or not? Or how do, you know, for people who live here, they want to know,
absolutely.
You know, how am I going to go about this?
I mean, as with any new technology, I think our health insurance system sometimes lets us down, you know. So majority of these treatments are currently out of the preview of coverage by healthcare insurances. We do offer the initial consultation as complimentary to the patients, so you know, they can come, they can discuss. I want to make sure that they have a good idea. Our whole goal during that consultation is to educate them, you know, so that at least they know that there's another option.
Yeah,
you know.
Exactly.
Now the interesting thing is that I've had patients who've come to me after knee replacement and joint replacement surgeries, and they have said that even with the insurance, their copays and other things ended up costing them so much after undergoing those surgeries that cost of paying for stem cell is actually minute compared to, you know, the other costs that come even with procedures. So I think our goal here is, and my goal would be especially to help prevent joint replacement surgery as much as I can in the future.
All right, very good. And doctor, again, great information. They're located in Newport Beach, Precise Care, and their phone number is 949-387-9991, precicecare.com. And as the doctor said, that if you're interested in this, give them a call. Maybe he can help you out. It's a free consultation, and you'll go from there. And I appreciate it. Nice to have you on, sir.
Thank you so much.
Good technology.
Thanks.
We'll be back.